also known as pertussis, is a highly contagious respiratory disease caused by the bacterium Bordetella pertussis. The disease is characterized by severe coughing fits that can last for several weeks or even months. It is most common in infants and young children, but can affect people of all ages. The bacteria spread through the air when an infected person coughs or sneezes. The incubation period for whooping cough is typically 7 to 10 days, but can range from 5 to 21 days. Symptoms usually start with cold-like symptoms such as a runny nose, low-grade fever, and mild cough. After a week or two, the cough becomes more severe and can lead to vomiting, exhaustion, and difficulty breathing. Whooping cough can be especially dangerous for infants and young children, as it can cause severe complications such as pneumonia, seizures, and even death. It is important for parents to make sure their children receive the recommended pertussis vaccine, which is given in a series of doses starting at 2 months of age. Treatment for whooping cough typically involves antibiotics to help reduce the severity and duration of symptoms. It is also important for infected individuals to stay home from school or work to avoid spreading the disease to others. In conclusion, whooping cough is a highly contagious respiratory disease caused by the bacterium Bordetella pertussis. It is most common in infants and young children, but can affect people of all ages. The disease is characterized by severe coughing fits that can last for several weeks or even months. It is important for individuals to receive the pertussis vaccine and for infected individuals to stay home from school or work to avoid spreading the disease to others. Whooping cough, also known as pertussis, is a highly contagious respiratory infection caused by the bacterium Bordetella pertussis. The disease is spread through respiratory droplets when an infected person coughs or sneezes, and it primarily affects infants and young children. The symptoms of whooping cough typically begin with a runny nose, mild cough, and low-grade fever, which can last for 1 to 2 weeks. After this initial phase, the cough becomes more severe and is characterized by a series of rapid coughs followed by a high-pitched whoop sound as the person tries to catch their breath. This coughing can be so severe that it can lead to vomiting, exhaustion, and even rib fractures. The bacteria that cause whooping cough attach to the cilia, the tiny hair-like structures that line the respiratory tract, and produce toxins that damage the cilia and cause inflammation in the airways. This damage to the cilia makes it difficult for the body to clear mucus and other debris from the lungs, leading to the persistent coughing that is characteristic of whooping cough. While anyone can get whooping cough, it is most dangerous for infants and young children, particularly those who have not been vaccinated or who have not completed their vaccination series. Infants under the age of 1 are at the highest risk for severe complications, including pneumonia, seizures, and even death. The best way to prevent whooping cough is through vaccination. The pertussis vaccine is typically given as part of the combination vaccine called DTaP, diphtheria, tetanus, and pertussis, for infants and children, and as Tdap, tetanus, diphtheria, and pertussis, for adolescents and adults. Vaccination not only protects the individual but also helps to prevent the spread of the disease to others, particularly those who are most vulnerable. In summary, whooping cough is a highly contagious respiratory infection caused by the bacterium Bordetella pertussis. The disease primarily affects infants and young children and is spread through respiratory droplets. The bacteria attach to the cilia and produce toxins that damage the respiratory tract, leading to the characteristic coughing. Vaccination is the best way to prevent whooping cough and its severe complications. 1. Garlic. Garlic has antibacterial and antiviral properties that can help fight off the bacteria that causes whooping cough. It also contains compounds that can help boost the immune system. 2. Ginger. Ginger is known for its anti-inflammatory properties, which can help reduce inflammation in the respiratory system caused by whooping cough. It also has antibacterial properties that can help fight off the bacteria causing the infection. 3. Honey. Honey has been used for centuries as a natural remedy for coughs and sore throats. It has antibacterial properties that can help fight off the bacteria causing whooping cough, and its soothing properties can help relieve coughing and sore throat symptoms. 4. Vitamin C-rich foods. Foods high in vitamin C, such as citrus fruits, berries, and leafy greens, can help boost the immune system and reduce inflammation in the respiratory system. This can help the body fight off the bacteria causing whooping cough. 5. Zinc-rich foods. Zinc is an important mineral for immune function and can help the body fight off infections like whooping cough. Foods high in zinc include oysters, beef, chicken, nuts, and seeds. 1. Processed foods. Processed foods contain high amounts of sugar, salt, and unhealthy fats, which can weaken the immune system and make it harder for the body to fight off infections like whooping cough. 2. Dairy products. Dairy products can cause mucus buildup in the respiratory system, making it harder to breathe and increasing the severity of whooping cough symptoms. 3. Fried foods. Fried foods are high in unhealthy fats and can cause inflammation in the body, which can worsen the symptoms of whooping cough. 4. Sugary drinks. Sugary drinks like soda and juice contain high amounts of sugar, which can weaken the immune system and make it harder for the body to fight off infections like whooping cough. 5. Alcohol. Alcohol can weaken the immune system and make it harder for the body to fight off infections like whooping cough. It can also cause dehydration, which can worsen the symptoms of whooping cough. Whooping cough, also known as pertussis, is a highly contagious respiratory infection caused by the bacterium Bordetella pertussis. It can affect people of all ages, but it is most dangerous for infants and young children. Here are some ways to prevent getting whooping cough. 1. Vaccination. The most effective way to prevent whooping cough is through vaccination. The pertussis vaccine is given as part of the routine childhood immunization schedule, and a booster dose is recommended for adolescents and adults. Vaccination not only protects the individual but also helps to prevent the spread of the disease in the community. 2. Avoid close contact with infected individuals. Whooping cough is highly contagious and can spread through coughing and sneezing. If you know someone who has whooping cough, avoid close contact with them until they have completed their treatment. 3. Practice good hygiene. Wash your hands frequently with soap and water, especially after being in public places or around someone who is sick. Cover your mouth and nose when coughing or sneezing, and dispose of used tissues properly. 4. Stay home if you are sick. If you have symptoms of whooping cough, such as a persistent cough, fever, and runny nose, stay home from work or school until you have recovered. This will help to prevent the spread of the disease to others. 5. Boost your immune system. A healthy immune system can help to fight off infections, including whooping cough. Eat a balanced diet, get enough sleep, exercise regularly, and avoid smoking and excessive alcohol consumption. In conclusion, whooping cough is a serious respiratory infection that can be prevented through vaccination, good hygiene, and avoiding close contact with infected individuals. By taking these steps, you can protect yourself and others from this highly contagious disease. Whooping cough, also known as pertussis, is a highly contagious respiratory disease caused by the bacterium Bordetella pertussis. The disease is characterized by severe coughing fits, which can make it difficult for the patient to breathe. Fortunately, there are several ways to cure whooping cough, including 1. Antibiotics. Antibiotics are the most common treatment for whooping cough. They can help to reduce the severity of symptoms and prevent the spread of the disease to others. Commonly prescribed antibiotics include azithromycin, erythromycin, and clarithromycin. 2. Vaccination. The best way to prevent whooping cough is to get vaccinated. The pertussis vaccine is part of the routine childhood vaccination schedule and is also recommended for adults who have not received it. The vaccine is highly effective at preventing the disease and reducing the severity of symptoms if infection does occur. 3. Supportive care. In addition to antibiotics and vaccination, supportive care can also help to cure whooping cough. This includes getting plenty of rest, staying hydrated, and using a humidifier or steam to ease coughing and congestion. 4. Isolation. To prevent the spread of whooping cough, it is important to isolate infected individuals from others. This may involve staying home from work or school until the infection has cleared, and avoiding contact with others who may be at risk of infection. 5. Alternative therapies. While there is limited scientific evidence to support their use, some alternative therapies may also help to cure whooping cough. These include herbal remedies like thyme and echinacea, as well as homeopathic remedies like Drosera and belladonna. In conclusion, whooping cough can be a serious and potentially life-threatening disease, but there are several ways to cure it. Antibiotics, vaccination, supportive care, isolation, and alternative therapies can all help to reduce the severity of symptoms and prevent the spread of the disease. If you suspect that you or a loved one may have whooping cough, it is important to seek medical attention right away. I hope you found this information helpful. Please consider subscribing and setting notifications for future updates.